Well, good afternoon, everyone. My name is Linda Hughes. I'm the Chair of Alberta Health Services Board, and I'm happy to welcome you to our monthly public board meeting. We have a full agenda today, but first I'd like to take a few minutes to address the Auditor General's report on integrated healthcare in Alberta, which was released last week. The issues raised in the report are extremely important, and on behalf of the AHS Board, I'd like to thank the Office of the Auditor General for its analysis of Alberta's healthcare system. For those who didn't see it, the report identifies 3 areas for improvement: structure, and specifically the relationship between AHS, the Department of Health, and the medical profession; integration of physicians, and specifically more attention to health results, accountability, and integration of physician services and other healthcare providers; and finally, clinical information systems. So information generated at all levels is available to patients, physicians, care teams, care programs, and health system leadership. AHS appreciates the report's analysis, and we are already working on shifting our collective thinking and approach to healthcare delivery. Specifically, AHS has 3 key initiatives underway to improve the integration of health services and to help AHS evolve into a high-performing, sustainable, patient-centered health system. One initiative, Enhancing Care in the Community, focuses on supporting people at home or in the community with enhanced care and supports to keep them healthy and well and out of hospital as long as possible. The second initiative, Primary Healthcare Integration, is enabling primary care teams both within and outside AHS to work more closely together to improve care for patients across Alberta as they move through the health system. And finally, we have started developing the foundation for AHS Provincial Clinical Information System. When that system is up and running, healthcare providers will be able to access comprehensive and consolidated patient information that will travel with patients wherever they access the health system. Details of this work and a way to measure our progress are outlined in our 3-year health plan and business plan, which is coming to the board today for approval. Once approved by our board, the plan will go to the health minister for her review. I'm pleased the Auditor General's report recognizes many other significant initiatives underway by AHS to improve quality and integration of care. Some of those highlighted initiatives include COACT, our innovative model of collaborative care now used in more than 160 hospital units across the province; our Patient First strategy, which puts patients, clients at the center of everything we do; our strategic clinical networks, which drive innovation and identify best practices that improve outcomes and experiences; and our patient navigators, who support patients and families in the area of cancer care, dementia care, and medical assistance in dying. While good steps have occurred, we know there's still a lot more that has to be done to achieve a fully integrated healthcare system. We know we must continue to enhance our healthcare system to be flexible, adaptable, and responsive to meet the changing needs of Albertans. And as Accreditation Canada noted last month, there is a shift and progress being made to improve integration. We look forward to continuing to work together with our partners, our stakeholders, and all Albertans to create a high-performing, sustainable, patient-centered system that supports the health needs of all Albertans. Now on to today's agenda, and as I said before, it's a full one. As mentioned earlier, the Finance Committee is bringing the 2017-2020 Health Plan and Business Plan to the Board for approval. The Committee is also seeking approval for the 4th quarter investment report, preferred accommodation rates, and restricted grant agreements. We'll hear from Community Engagement Committee, which seeks approval for Advisory Council appointments, term extensions for Health Advisory Council chairs, and appointment of trustees and amended bylaws for some of the province's health foundations. The Quality and Safety Committee is bringing forth revisions to AHS Quality Assurance Committee templates. And finally, the Audit and Risk Committee will be seeking approval for AHS's 2016-17 Accountability Annual Report and the AHS Consolidated Financial Statements ending March 31st. Before that, we'll hear from our President and CEO, Dr. Verna, about new community engagement efforts from our Emergency Medical Services team. She also has a video for you to enjoy. Now, before I turn the mic over to Verna, does everyone have the agenda? Could I ask someone to move approval of the agenda? Hugh and Glenda, thank you. All in favor? Okay. Declaration of conflict of interest. Does anybody have a conflict of interest they'd like to declare at this time? Okay, seeing none, thank you. You've all seen the minutes of our April 27th meeting. Do anybody have any questions or issues? Okay, no. Could someone recommend approval? Brenda? Seconder, Hugh? All in favor? Great, thank you very much. Now I'd like to pass this over to Verna for remarks.
Thank you, Linda, and good afternoon, everyone. It's a great time of the year, and especially if you're a member of our emergency medical services teams. This week is National Paramedic Services Week, and it continues until Saturday. During this week, our EMS teams across the province have been meeting with Albertans and raising awareness about the work of EMS personnel and their contributions to the healthcare system. These teams are inviting members of their communities to participate in station tours, ambulance tours, and equipment demonstrations. And as you'll see in a video coming up, these tours are a lot of fun for Albertans, especially for the children. I'm very proud of our EMS crews, and I'd like to share some facts and statistics about their work. Every year, about 5,600 EMS professionals respond to more than 320,000 911 calls, 170,000 interfacility transfers, and more than 7,000 fixed-wing medevac flights. AHS EMS currently has 450 ground resources, including ambulances, interfacility transfer vehicles, and non-ambulance transfer vehicles such as wheelchair accessible vans. We also have 11 fixed-wing aircraft and access to 3 dedicated helicopters through STARS. AHS Consolidated Dispatch System monitors all of these resources in real time, so we always know where every EMS vehicle is. And since EMS operations are no longer restricted by local boundaries, we can always ensure that the closest available resource is sent to an emergency, no matter where it occurs in the province. But to fully grasp the measure of EMS work, you have to look beyond the numbers and hear the stories of Albertans who have been helped by paramedics and their colleagues during moments of crises. I encourage you to visit thankaparamedic.com to read many notes of appreciation from Albertans whose lives have been touched by the work of our hardworking and dedicated EMS personnel. The stories in these notes really underscore why we do what we do in healthcare. We know Albertans respect and value our EMS crews. So recently, our EMS team developed several online tools to reach out to Albertans and share details about their work and their colleagues across the province. We have a video about these new tools.
Hey guys! Hi. I'm glad you could come to our EMS station. Are you excited for the tour? Yeah! All right, come on! Stick your thumb in there. Finger? Okay. And his pulse. Anything over 94 is good. And your pulse is 134.
I'm very proud to be a paramedic. That is why I'm delighted when Albertans want to learn more about EMS in their communities and the good work we are doing every day.
How do you turn on the siren?
It's that green button right over there. We do tours and open houses at our stations throughout the year. Was that fun?
Yeah.
And recently, we developed new tools to reach out to Albertans to share information about our work and our people.
Ask a Paramedic is an opportunity for Albertans to learn more about AHS EMS and the care we provide. Albertans can send their questions to ahsems@ahs.ca, and we'll do our best to answer them at ahs.ca/EMS and on the Alberta Health Services YouTube channel.
So, do all paramedics do the same sort of work?
That's a really good question. We actually get asked that all the time.
Meanwhile, the Your EMS video series is a behind-the-scenes look at the men and women who provide this care, as well as the equipment, tools, and programs they use.
I'm Rania Ballhorn. I've been out in Kananaskis as a paramedic for 10 years here.
My name is Mike Chung, and I'm a paramedic in the EMS Community Care Program in the Edmonton Zone.
Hi, my name is Melanie Horner. I'm an EMT and I work in Save Light here in the North Zone.
I'm Don Sharp. I'm a registered paramedic here in Alberta. I work with Alberta Health Services in the Calgary Metro Zone.
You'll also find these videos on ahs.ca/EMS and on the Alberta Health Services YouTube channel.
Meanwhile, we're also sharing information and stories about EMS on our new AHS EMS Facebook page. Just search for Alberta Health Services EMS. Thanks for coming. It's right out this way, okay?
Thanks for coming, guys.
Thanks.
Hope you had
Thanks
fun.
for coming.
Thank you for coming.
Thank you.
And finally, you can thank an EMS crew for a job well done anytime at thankaparamedic.com.
We make sure your words of gratitude make it to the appropriate people and teams.
Lives are potentially on the line whenever EMS is called. I am proud of the fact that when Albertans need us, we're there.
And we're honored that Albertans care about and are interested in our people and our work.
We invite you to check out Ask a Paramedic, our Your EMS video series, Thank a Paramedic, and our social media sites on Facebook and Twitter. We'll see you soon at an open house in your community.
Because in person or online, we're here for you.
I'd like to thank AHS EMS teams for coming to the aid of Albertans throughout the year, and I'd like to congratulate them for their National Paramedic Services Week events and for their new suite online tools. It's always good to keep the lines of communication open with the people that we serve. Before I close, I'd also want to offer congratulations to my colleague, Dr. James Sylvius, the AHS Senior Medical Director for Seniors Health. The Canadian Medical Association recently bestowed Dr. Sylvius with its Dr. William Marsden Award in Medical Ethics for preparing Alberta for federal legislation dealing with medical assistance in dying. The association recognized the hundreds of hours that Dr. Sylvius spent working with the College of Physicians and Surgeons of Alberta and others to consult with physicians and solicit their viewpoints on the issue. Speaking on behalf of AHS, we're grateful to Dr. Sylvius for gathering perspectives on the issue from across Canada and around the world to help our organization prepare for the most significant change to medical practice in decades. Congratulations, Jim, on this prestigious and well-earned honor. I'd like to thank you for your time today and for your continued interest in AHS.
Thank you, Verna. Now, if we could move on to the Community Engagement Committee. Brenda?
Thank you, Madam Chair. The Community Engagement Committee met on May 11, 2017. At the meeting, the committee was provided an update on community relations with Advisory Council and foundations, an update on the work regarding the development of support guidelines for the foundations, and the concept of developing a vision for the foundations. Ms. Lucille Partington, Chair of the Peace Health Advisory Council, gave a very interesting overview of the work and the objectives of that council. The committee really appreciated her time. The committee reviewed the work plans for the advisory councils and considered 5 items for recommendation for approval, which I'll bring here today. The first is with respect to the advisory council member appointments. Under the amended bylaw for Alberta Health Services establishing health advisory councils, the board is required to approve appointments of members to health advisory councils. Under the amended bylaw for the Addiction and Mental Health Provincial Advisory Council and the amended bylaw for the Cancer Provincial Advisory Council, the board is required to approve appointments of members to provincial advisory councils. The committee reviewed appointments to certain advisory councils effective June 1st, 2017, and recommended that the AHS board approve such appointments. We're very grateful for the commitment of our volunteers across the province. We value their work and appreciate their commitment to health care in the province. Accordingly, I move that the Alberta Health Services Board approve the appointment of Daryl Comeau for a 3-year term to David Thompson Health Advisory Council, to Lindy Fours for a 3-year term to the Addiction and Mental Health Provincial Advisory Council, and Michelle Zielinski for a 2-year term to the Cancer Provincial Advisory Council. I so move.
Could I have a seconder? Hugh? All in favor? Carried. Thank you.
Thank you. The second recommendation is with respect to the Health Advisory Council chair term extensions. The bylaws for Health Advisory Councils provide that an elective council chair may only serve for more than 6 years if so approved by the AHS board. 4 council chairs that have been re-elected by their councils require board approval for the extension of their terms. The committee reviewed the appointments and recommended that the AHS board approve the extension of term for the 4 re-elected council chairs based on long-standing commitments. Accordingly, I move that the Alberta Health Services Board approve the term extension for 4 re-elected Health Advisory Council chairs as follows. Kenneth Chair, Palliser Triangle, extended from May 2016 to May 2018. Larry Albrecht, Prairie Mountain, extended from May 2016 to May 2018. Ken Matthews, Lesser Slave Lake, extended from January 2018 to May 2019. And Ruth Martin Williams, Tamarack, extended from May 2018 to May 2019. I so move.
Thank you. Could I have a seconder? Marlis? All in favor? Carried. Thank you.
The third is with respect to amended bylaws of the Mental Health Foundation. The committee was presented a request to amend the bylaws of the Mental Health Foundation to change the maximum allowable number of trustees from 14 to 18. Under the Regional Health Authorities Foundation's regulations, AR 28/2007, the amended bylaws must be reviewed by the AHS Board and forwarded to Alberta Health for ministerial approval. The committee recommended the Board approve the amended bylaws of the Mental Health Foundation. Accordingly, I move that the Alberta Health Services Board approve the amended bylaws of the Mental Health Foundation in the form reviewed by the Board and direct management to submit the amended bylaws to Alberta Health for ministerial approval. I so move.
Could I have a seconder? Glenda? All in favor? Carried. Thanks.
The fourth recommendation is with respect to the amended bylaws of Strathcona Community Hospital Foundation. The committee was presented a request to amend the bylaws of the Strathcona Community Hospital Foundation. The amendments to the bylaws are mainly for the sole purpose of moving the bylaws into the current foundation bylaw template form that is agreed to between AHS and Alberta Health. Under the Regional Health Authorities Foundation's regulations, AR 28/2007, amended bylaws must be reviewed by the AHS Board and forwarded to Alberta Health for ministerial approval. The committee recommended that the Board approve the amended bylaws of the Strathcona Community Hospital Foundation. Accordingly, I move that the Alberta Health Services Board approve the amended bylaws of the Strathcona Community Hospital Foundation and direct management to submit the bylaws to Alberta Health for ministerial approval. I so move.
Thank you. A seconder? Hugh? All in favor? Carried. Thank you.
And finally, the final recommendation is with respect to Q1 appointments of trustees to health foundations. The HS Board has a responsibility to appoint trustees to established foundations pursuant to the Regional Health Authorities Foundations regulation. The committee reviewed appointments to certain foundations effective June 1, 2017, and for the term specified. The committee recommends that the HS Board approve such appointments. We're very grateful for the commitment of our foundation volunteers across the province. We value their work and appreciate their commitment to healthcare in the province. Given the number of appointments, the names will not be read in this meeting, but will be incorporated into the minutes of the meeting and posted publicly. Accordingly, I move that the Alberta Health Services Board approve the trustee appointments or reappointments to the foundations effective June 1st, 2017, as reviewed by the committee and the Alberta Health Services Board. I so move.
Seconder? Glenda. All right. All in favor? Carried. Thank you. Hugh, Governance Committee report.
Thank you, Madam Chair. The Governance Committee last met on May 11th. Our new interim Chief Ethics Officer attended at the meeting, provide a quarterly update. The committee had an interesting discussion on the generalities of the Accreditation Canada work that's going to be done in the criteria for governance. We also received a policy report outlining certain corporate and clinical policies. This will be a standard item presented to the committee on an annual basis. In addition, the committee considered its processes for identifying and assessing board member skills and competency matrix, as well as discussing ongoing educational and orientation opportunities. There were no items presented at the committee to be considered by the board for formal approval.
Thank you, Hugh. HR, Human Resources Committee, Richard.
The committee met yesterday, May 31st. It discussed success measures under our people strategy. It received an update on labor relations and essential services. It discussed senior leadership compensation, and finally received an update on workplace health and safety. There were no items that came forward for board approval.
Thank you. Very succinct. Thank you, Richard. Quality and Safety Committee. Glenda?
Thank you, Madam Chair. The Quality and Safety Committee met on May 24th, 2017. The committee began the meeting with a discussion on long-term care. We then received an overview of the Alberta Health Services response to an outbreak in an antibiotic-resistant organism. And then we discussed the AHS Infection Prevention and Control Surveillance Program and how this program used the outbreak experience to help strengthen communication, contact tracing, and surveillance processes. The committee discussed the close working relationship that AHS has with Alberta Health when dealing with outbreaks of this nature. The committee discussed the on-site survey by Accreditation Canada in May of this year, during which 30 surveyors surveyed 129 AHS sites. The committee discussed the major strengths so far that have been identified by Accreditation Canada, including that AHS had made significant, tangible progress towards a fully integrated health system, and that staff are passionate and show pride in their work at AHS. The committee commended management on their good work. The committee discussed patient safety and received certain quality reports. We considered an item for approval which involved amendments to the Quality Assurance Committee, local, complex, provincial, and subcommittee terms of reference templates. The committee recommends that the board approve such amendments. Accordingly, I move that the Alberta Health Services Board approve changes to the Quality Assurance Committee, local, complex, provincial, and subcommittee terms of reference templates as reviewed by the board. I so move.
Seconder? Brenda? All in favor? That's carried. Thank you. Back to you, Richard, Finance Committee.
I will not be as succinct. The Finance Committee met on May 25th and considered 3 items for consideration by the board. First, a fourth quarter investment report. As mandated by AHS's investment bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of AHS's investment portfolio on a quarterly basis. The Regional Health Authority regulation and the AHS investment bylaw describe the requirement for the board to approve or ratify resolutions of AHS's investment decision. The committee was presented the March 31st, 2017 fourth quarter investment report and recommends that the board ratify the transactions. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions as described below and as certified by signed investment compliance certificates from AHS and Phillips Hager and Nort Investment Management. A. As of March 31st, 2017, AHS held restricted and unrestricted funds managed by Phillips Hager and Nort Investment Management and Manulife Financial totaling $1.775 billion. B. The funds were invested in short-term treasury bills, federal, provincial, and corporate fixed income bonds, pooled mortgage funds, bond funds, Canadian and global equity funds. And C. All of the funds invested during the quarter ended March 31st, 2017 were invested in accordance with the investment bylaw and investment policy as certified by signed investment compliance certificates from AHS and Phillips Hager and Nort Investment Management.
So moved.
I so move.
Do I have a seconder? Glenda? All in favor? Thank you.
Second item. The 2017-2020 Health Plan and Business Plan, including the 2017-18 budgeted financial statements. The committee reviewed a draft of the 2017-2020 Health Plan and Business Plan, including the 2017-18 consolidated budgeted financial statements. The committee recommended that the board approve the plan and the budget, which included the reserve transactions. Such reserve transactions are in addition to the expenses outlined in the budget. The plan and the budget will be submitted to the Minister of Health for approval. After ministerial approval is received, the plan and the budget will be posted on the public website. The committee recommended that the board approve the plan and the budget. Accordingly, I move that the Alberta Health Services Board, A, approve the 2017-20 Health Plan and Business Plan, including the 2017-18 consolidated budgeted financial statements, which includes the reserve transactions in the form reviewed by the board, which such non-substantive changes that management of AHS considers necessary or advisable. B, authorize and direct management of AHS to deliver the plan and the budget to the Minister of Health for approval, and after receiving such approval, make the plan and the budget available to the public through the AHS website. I so move.
Seconder? Marlis? All in favor? Aye.
Third is with respect to the setting of the preferred accommodation rates. The board is to approve preferred accommodation charges pursuant to the hospitalization benefits regulation. The board supported the use of Alberta CPI as a basis for rate adjustment. Once every 3 years, AHS will review the applicability of the preferred accommodation rate formulas and inform the AHS board of the outcome of this process. The committee recommended that the board approve the preferred accommodation charges as reviewed by the committee and delegate the authority to the president and CEO to apply the formula for future years. Accordingly, I move that the Alberta Health Services Board, A, approve the increase in the preferred accommodation rates effective July 3, 2017, based on 2015 and 2016 increases in the Alberta Consumer Price Index for healthcare goods and services. Approve the application of the formulas reviewed by the board for the purpose of adjusting the preferred accommodation rates on April 1st of each subsequent year, and C, delegate to the AHS President and CEO the authority to approve annually the preferred accommodation rates calculated through the application of the above formulas. I so move it.
Seconder? Verna? All in favor? Thank you.
Finally, that this is the report from the May 25th meeting of Finance Committee. I'd like to speak to a motion for the board to approve 2 restricted grant agreements between Alberta Health and Alberta Health Services. First, with respect to the South Sector Academic Medicine and Health Services Program, and the second with respect to the North Sector Academic Medicine and Health Services Program. Both are with respect to the provision of clinical and non-clinical services at universities and AHS facilities by physicians participating in an academic medicine and health services program. Each grant agreement exceeds the approval and signing authority of the President and CEO, and therefore needs to be approved by the board. The board will approve the grant agreements, terms which were reviewed by the board, and delegate signing authority of the agreements on behalf of AHS to the President. Accordingly, I move that the AHS Board approve the grant agreements for the provision of insured medical services and education, research, and leadership administrative services at the University of Calgary and at AHS facilities by physicians participating in the South Sector Academic Medicine and Health Services Program for the term of July 1st, 2017 to March 31st, 2020. And the provision of insured medical services and educational research and leadership administrative services at the clinical services and non-clinical services at the U of A and at AHS facilities by physicians participating in the North Sector Academic Medicine and Health Services Program for the term July 1st, 2017 to March 31st, 2020, and to delegate the authority to execute these 2 grant agreements on behalf of AHS to the President and CEO. So moved.
Thank you. Seconder? Glenda? All in favor? It's carried. Thank you. And finally, our Audit and Risk Committee, Glenda.
Thank you, Madam Chair. The Audit and Risk Committee met on May 25th and then again this morning on June 1st. Standard practice is that the Office of the Auditor General, as well as KPMG, are guests at the meetings in their role as the external auditors of AHS. On May 25th, the committee reviewed drafts of the annual report and the year-end financial statements. In addition, the committee reviewed the results of an internal audit report and received an overview of the insurance program. On June 1st, this morning, the committee received the Auditor General report of the Audit and Risk Committee for the year ending March 31st, 2017, and the committee also reviewed a final draft of the AHS 2016-17 annual report and recommended that the Alberta Health Services Board approve the annual report. Following from these meetings, Madam Chair, I have two motions. The first is that the Alberta Health Services Board A, approve the AHS 2016-17 annual report in the form reviewed by the board with such non-substantive changes that management of AHS considers necessary or advisable, and B, authorize and direct management of AHS to deliver the annual report to the Minister of Health and to later make the annual report available to the public through the AHS website. I so move.
Thank you. Seconder? Hugh? All in favor? Carried. Thank you.
And then secondly, the committee also reviewed a final version of the March 31st, 2017 consolidated financial statements, the establishment of internally restricted surplus for future purposes, and the financial statement discussion and analysis. The committee recommends that the board approve these items. Accordingly, I move that the Alberta Health Services Board, 1, approve the internal restriction of $714.305 million to represent the amount of unrestricted surplus invested in tangible capital assets as at March 31st, 2017, and not available for any other purpose. 2, approve the internally restricted surplus for future purposes as at March 31st, 2017 of A, $112.718 million to represent the amount of unrestricted surplus related to ancillary services. B, $42.224 million to represent the amount of unrestricted surplus related to insurance equity requirements and not available for any other purpose. C, $39.987 million to represent the amount of unrestricted surplus related to foundations and not available for any other purpose. And D, $30 million for other defined initiatives. 3, approve the AHSA consolidated financial statements for the year ended March 31st, 2017, as reviewed by the board. And B, financial statement discussion and analysis for the year ended March 31st, 2017, both for inclusion in the AHS 2016-17 annual report, and both in substantially the form reviewed by the board with such non-substantive changes that management of AHS considers necessary or advisable are hereby approved. And 4, authorize and direct management of AHS to take all such other action as management of AHS considers necessary or advisable in order to give full effect to the foregoing. I so move.
And a seconder? Hugh. All in favor? Thank you very much. That represents an awful lot of work in a short time, and I just want to say thank you particularly to management and all the leaders in AHS for a lot of work in the last month or two to get this done. So thank you very much. And we're adjourned. Thank you.